Hello and welcome to our AvaSure webinar series on how to retain and recruit virtual safety attendants. We have, I think, 170 some that have signed up for this, so your lines will be muted, but you're able to type questions in, and we already got some questions that we hope to cover when people registered, and welcome everyone. This is such a pertinent topic right now, and we're going to focus on the aspect of the nursing or the workforce shortage in healthcare that's not necessarily RNs, it's the allied health professionals, and they are also hard to recruit and retain right now, as we know. And I like to follow the NSI Solutions annual survey that comes out on healthcare turnover, and so that comes out in October. And last October, the healthcare position that had the highest turnover was patient care techs, and it had moved up from 29% to 38% from 2020 to 2021. And then the next one was nursing assistants, certified nursing assistants, really high up there as well. So that really affects this role of the virtual safety attendant, which is the linchpin of a successful telesitter program. And so that's why I've invited some nurse leaders to share what they are doing right and how their program is going well, and how it's, you know, fully staffed and they're able to impact patient safety. So we have Lori Colineri, the chief nurse at JFK Hackensack Meridian in New Jersey, and Tiffany Villamin, a nurse manager from the Dallas VA. So welcome both. And let's just jump right in. And if we could just start with maybe introduction of yourself and a little bit about your AvaSure Telesitter program by the numbers. So do you want to start, Lori?
Sure. Hi, good afternoon, everyone. Thanks for joining. This is really exciting to share this information. My name is Lori Colineri. I am the Chief Nursing Officer here at Hackensack Meridian Health, JFK University Medical Center. We have been live with our AvaSure monitoring program since about the very end of May, beginning of June of 2022. So it's been a great journey. We've seen some great outcomes. We went live with 25 devices and quickly found out that we needed more. So we're in the process of onboarding another 15 shortly, sometime in the next month, hopefully. And it's been a great addition, and we've seen some great utilization of the technology.
Thanks, Lori. So there are several who have registered for the webinar who are just about to begin their program or newer along. So you're live less than a year. So it's kind of encouraging, like, yes, we can get there, and it's not going to take us, 10 years to get a really good mature program. Tiffany, you all have been live a little longer than that. Do you want to introduce yourself and talk a little bit about the program there?
Sure. So I'm Tiffany Villamin, nurse manager here at the Dallas VA. We initially started our program with 24 cameras and just recently acquired another 24 because we saw the need for demand. So we're currently in the process of hiring more staff in order to monitor those cameras. And we've been live for 3 years now. So we are a pretty well established program here.
Lori, I'll have you kind of keep the mic right now and just talk about the model of how do you divide that out, how many stations, and
sure.
You staff that on a day-to-day basis, and the oversight as well.
Sure. So our staffing model that we created to be able to use a blended model, we were using an enormous amount of patient sitters for safety, suicide, et cetera. So when we transitioned our model to incorporate the AvaSure monitoring technology into that platform, we utilized our sitters, or our safety sitters, and trained them, educated them. Actually, they went through an onboarding process through interview to be able to be part of this, because the type of person that you get really is important. So we have dedicated at this point 17 full-time FTEs, 6 part-time FTEs, and we have a bunch of per diems. Right now we have 7 per diems. The department is overseen by a nurse manager, just like Tiffany, and that person is also overseeing our whole staffing plan. The manager is responsible for the communication, the dissemination of the information, risk stratification of the patients who are being requested to be on a device, on the monitoring, video monitoring, as well as communicating with the inpatient unit managers and so on. We have 2 monitors that we are staffed fully, and we have a third that is in our brain trauma unit that's actually physically on the unit, where there is a technician sitting there watching those monitors. Our brain trauma unit is part of our rehab hospital. So so it's very important that person is right on the unit, because these are severely impacted trauma patients and very cognitively impaired. So we have also have rounders who round to the technicians, and they break them, and they go every 2 hours for breaks. We also utilize the rounders to be able to deploy devices. So when there's a new device coming online, they go deploy the device and/or mitigate if there's any issues at the bedside, and then transition the patient off the monitor when the monitor is discontinued. It's really important that we had the runners, and I call them the runners, the rounders in place, because it's really important to relieve that, every 2 hours sitting there is extremely taxing. So really to have breaks, to get up to stretch, to, stretch your eyes, stretch your brain, relax your brain, and then rotate through. So everybody does rotate.
That makes sense. How is your program or model similar or different, Tiffany?
So similar to Lori's model, we have a total of 4 monitoring stations right now, because we've already acquired the 2 additional monitors, but we're staffed for 2 at the moment. I have 24 FTE that run the program around the clock. Again, very similar model to Lori, where we have 2 staff on the monitor, and we call our person the float. So the person that's able to float to the units, to admit, discharge, relief for breaks. And the one thing that we had that's kind of different, a position we created here specifically that actually ended up being best practice, is I have a LVN that works with me, and we call her the lead of the program. So because I'm the nurse manager over the program, but I also have a lot of other administrative duties to care for. So the LVN lead takes care of a lot of the clinical coordination, reviews the data, collaborates with the staff, helps with the education. She goes around and with the float sometimes, and will speak to the nurses to encourage people to use AvaSure. And one of the things she also does is monitoring the emergency room. So on the intake side, looking at why they're admitting diagnosis, and seeing if we can put them on camera early before they're hitting the units. So that has really helped with our utilization across the board.
And I think the topic of the webinar today isn't utilization, but having a fully staffed and trusted group of pretty dedicated virtual safety attendants is foundational to have good utilization. And that's part of the reason why I asked you two to be and talk about your different programs, is because you both have that, and then therefore high utilization of your devices to make sure that you're helping as many of your patients as you possibly can. What are your monitor staff to patient ratios? How many patients does one virtual safety attendant watch?
So we're about 12 to 1 at this point. Mm-hmm.
We are the same here, 12 to 1 is the max.
Okay. And I find myself even using different terms, because we haven't, as an industry, I think, settled on a term. So I know I said the title is virtual safety attendant, but different organizations call it different things. And just for fun, I think we have over 100 that registered who have a program already. So we're just going to throw a poll question out there to see, what do you call this role of the staff member that's not an RN, but is a virtual sitter that is, and pick the one that's closest, because there are all kinds of versions of the same same title. But it's usually, and we'll go into next question will be a little bit about how they're recruited and what their requirements are for recruiting. But usually it's not an RN, and there are different levels of requirements that people have. So I'll give it another second and let's see how that's panning out. Oh, I didn't see that. Oh, there we go. Oh, a lot call it the telecenter monitor tags, virtual safety attendant, or monitoring attendant, patient safety observer, remote observer, other. So yeah, we still haven't settled exactly. I loved one health system said, you know, they call them one of those, but they said we also like to call them safety ambassadors. And so just really elevating the role, which is mainly what we're going to be focusing on today. So let's talk a little bit about how you recruit. So what are your hiring requirements for this role? And so do you want to start this time, Tiffany?
Sure.
How do you recruit and what are you looking for?
So recruiting is probably the most important thing that we do to sustain and grow the program. You know, resume review is always first. So what we look for is, it is a nursing assistant role here for our facility, first and foremost. We try to at least weed out candidates by having at least 1 year of experience. I tend to look for staff that have worked in a rehab setting, acute care, and even psych. I find that that's a really good combination of staff that can pick up on preventing adverse events. And we also, one question I'd like to ask during the interview is, do you have any experience monitoring patients? So oftentimes I'll find staff that have worked in a psych area have already had experience monitoring patients on camera because they have to do their 15-minute checks. I've also even had staff, surprisingly, that have had some type of AvaSure, whether it be private sector or VA. And, you know, because they see the job posting, it's for a similar position, then, you know, of course, it's a great fit for us to have staff that have already had experience with the program. So that's typically what we look for as we're recruiting.
And I think somebody had typed in a question, and so this is whoever you are that typed in this question, like how do you train non-clinical staff for this role, is what you do there is really look for a year of experience, because what we hear is a nurse might give report to or handoff to the virtual safety attendant and say, you know, this patient's fall risk, but he also has a Foley and he has blah, 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 blah. And if that person doesn't have experience or training, they might not know what that means. And if the, you know, patient's hands under the covers, they wouldn't even know to be concerned about that. So that clinical background is part of what you do there. How about you, Lori?
Very similar to Tiffany. Absolutely, you know, almost verbatim, you know, I would say exactly what she said. You know, one of the things I'll add too, and Tiffany had talked about this earlier when we were all talking, we do also look for diverse candidates. We look for those candidates, you know, who do have at least a year experience in a medical field. We are onboarding and looking for, and into this position, these are non-clinicians. A lot of the folks that we get in that we're onboarding now are student nurses or students or learners in some other field, allied health field. And we actually look for that, which is, it's a good way and good introduction to get involved into something that is not quite at the bedside yet, but they definitely have a good skill set or a good trajectory and journey into learning in the healthcare arena. We also, since this is a support, you know, we have some ancillary support people who are also interested, who come from other areas within the hospital, such as like EVS or EVS workers, and they get wind of it and they see, you know, so sometimes we will even go to help to recruit. But, you know, we do a good job with posting our position, you know, externally and internally, people who are coming looking to enter into a workforce that is healthcare based. And, you know, asking some of those very similar questions that Tiffany said that she talked about, really looking for the person who's going to be accountable, who is able to hold accountability to, this is a very extremely sensitive position, as well as, we need to have reliability at that, for that person, has to be very reliable, and be willing to be courageous to be able to intervene. So that is another characteristic that we look for when we're screening some of the candidates.
And so I like that this is a career path, maybe for some of your internal great employees in EVS. And then they can see, oh, I can move up to this telesitter position. Someone typed in a question, which I think is really relevant right now. So I'm just going to put that out there. Are you hiring these individuals solely for telesitting, or do they have a dual role? So yeah, love to have the response to that. Are they dedicated to this position?
So here in our program, because they are nursing assistants, within their functional statement, they are expected to still engage in patient care as needed. When I have extra staff that are scheduled, we will have them go to the units to either supplement as a one-to-one, or they can help out on any type of acute care unit and just be on the floor. So, and I think that's good for them to just get a break from the room. They're able to, be back into the patient care areas, and they're able to pick up on things quickly too as they're observing their patients and helping them out. So yes, it is a multifaceted role here at our facility.
We utilize a patient sitter model. So we are our sitters and AvaSure technicians are not PCTs or PCAs, whatever we call them, nursing assistants. We do have some PCAs who are cross-trained to be patient sitters. So we utilize the blended model of patient sitters at the bedside for safety and or suicide risk, and the AvaSure technicians. So they're trained in all three of those arenas or those needs, so that they can all rotate through.
And then I just know that from some of our other hospital partners, sometimes telemetry techs are cross-trained, and then there becomes this efficiency of side. If you have the luxury of having a hub or a space where you can have some more of that, then they can break each other, and it becomes more efficient that way. So moving from, well, before we go on to training, you both talked about the kind of the type of person that really is, I think, courageous and patient-centered. And so we were talking about just before we started the webinar at the VA, something that you do that's very patient-centered for residents that the monitor techs do. Tiffany, do you want to talk about that a little bit?
Yeah, so here with our population, because PTSD is something that is an issue within veterans, and not only really veterans, but I'd say that even the general population, because people may have that diagnosis and you may not know. So we're really mindful when we are activating an alarm to alert the staff that the patient is in imminent danger. When we admit the patients to the program, we play the sound so that they know what it sounds like, so they're not startled in the middle of the night, or and even it's probably good for people that are in the room. So if there's a second patient in the room, just so they have that awareness on what it is. And I think that really helps them know that that's us trying to help you, and to not be startled or scared by it. And it's because we're trying to call the nurses in to help you. So we try and stress that to the patients. And again, it's just a great way that our staff are being patient-centered and focusing on their needs, because they're trying to get well in the hospital. We don't want to create any more stress for them, but we want to keep them safe.
Yeah, I love that, and I think it's a really good example, and just like, oh, I want to spread that as a best practice. So any chance I get to mention it, I think it's great. We probably have our clinical educators start to add that as we're implementing more hospitals. So after recruiting, what does orientation look like for you both? And maybe while you're thinking about that, I'll do a poll question again. So, because we have all these polls teed up. And so we do at AvaSure do provide 5 e-learning modules as part of the implementation. So those on the line that are already have a program, let's just do a quick poll to see whether if you use the AvaSure learning modules. And also we're checking to make sure everybody's aware. So we have a learning module that is focused on bedside staff, more on patient selection, and it's shorter. And then we have a basic one for monitoring staff, really how to use the technology and on patient dignity and privacy. And then we have some more specialized on documentation, suicide risk patients, geriatric sensitivity, those types of topics. And so want to find out too, make sure if you're not aware, tell us. That way we make sure that people are aware that you have that and can use that annually too for turnover. And so let's see where we're at with our second quick poll. Okay, so there's a significant that was not aware, but mostly 70% do use the modules. So Lori, you were about to talk about what you do on orientation.
Yeah, sure. So we do use the AvaSure learning modules. We built them into the LMS system, which is our online learning platform. And we make sure that, of course, every one of our sitters who are onboarding go through all of the modules. There's a comprehensive orientation for those people to really look for, scenario-based, education, as well as the orientation to just, the actual devices themselves. What are the expectations, and so on and so on. We also utilize the LMS modules in the AvaSure learning modules for our nursing staff during orientation, our nursing residency programs. They all go through that with a very dedicated session to the AvaSure monitoring and video monitoring. It's been very important to us to be able to get that in front of our nursing staff and our leaders, our nursing leaders. Both our nursing leaders and our non-nursing leaders have to go through a brief LMS module as well. So we've realized over time, since we initiated and went live, that this was needed. So we've built in non-clinicians into this as well. When my hospital president said, "Why do I have to take this?" She even has to take it. So so it's really interesting, and it was an aha moment for us that we really needed to incorporate other non-nursing and non-clinical people into this fold so that they really understand. Anybody walking past a room or here's the device alarming is responsible. We have a no pass zone requirement in our organization, and this is one of those instances where we need immediate attention, so anybody could really respond. So we've incorporated it into most of our orientation, and again, it's very important for all of our organization to be able to respond and understand this technology.
I think that's a really good idea beyond just the nurses that are primarily responsible for selecting the right patients, but beyond that too, because there are some common misconceptions that you can clear up that way, that it doesn't record and how we're protecting privacy and those types of things. It's not just a policing accountability tool for the bedside staff. It's really focused on safety for patients. So how about you, Tiffany?
Well, I just want to first commend Lori. I think that's a really great practice. I actually might kind of steal that idea from you and start having some of our providers. I think there is definitely a gap with providers understanding and seeing the value of the program. But as far as orientation, again, I don't want to repeat a lot of what Lori said, but very similar. We use the modules that are uploaded already. One thing that we do here, though, is we make sure that all the nurses in orientation take it. And actually, Lisbeth was able to provide some data to me that I wasn't even aware of. And we've had close about over 900 staff now just take that basic intro module, which is really great. I mean, it makes sense. We've had our program for about 3 years now, so the numbers kind of speak for themselves. So our monitor techs typically do about 2 weeks on the monitor just for that orientation piece. And then we train everybody in the room to do the float or the running part. I believe that, when there are call-ins, things happen, everyone has to be versatile and able to take on that role. Because when there are call-outs, the last thing you want is to not be able to have someone that can do that role. So we let them be on the monitors probably for about a good 2 to 3 months, and then we train them to do the float. So we really want to make sure they're comfortable, they are experts at what they're doing on the monitor before we train them to be float, because that's almost like the next step and like the next role to learn. We don't want to mix it too close because we really want them to focus on being an expert monitor staff before doing the float. And that way they can understand and support their colleagues that are new, that are orienting. So they kind of know both ways, because it's important to have good people to also orient for the recruitment and retention of your staff. So, we have our key folks, but everyone, we tell them, you're going to learn. And it's good because it gets them out of their comfort zone. Sometimes they do get comfortable just being on the actual monitor, but it's that opportunity to float that really kind of breaks them out of that shell and gives them an opportunity to do something a little bit, outside of what they would typically be doing as nursing assistants.
Yeah, that's great. I was helping out one time monitoring, and then I got to go see the patient and talk to the patient. And I said, that was my voice earlier. And he was like, oh, you big brother. And I'm like, no, I'm big sister. So yeah, that does give a better, and then that person is the one that's interacting with the nursing staff. And
yes.
And so that I see that might be a higher level, more experienced role.
Yes.
Before I move on to retention, I just want to wrap up. Someone asked a really good question, and the question is, anyone dropped the CNA requirement so that certified nursing, the certification, like a certified nursing assistant requirement? And I didn't hear either of you say that was a requirement.
No.
Okay. Yeah,
It's
I know some,
so.
but yeah, and maybe experience is even more important than that.
Yes.
Certification. Yeah. Okay. And let's talk a little bit about retention. Lori, what have you done to really set high expectations for performance in this role and in your short time, 9 months?
Sure.
And I keep asking questions and then keep talking, but I just want to compliment you because when I looked at your ORNA data there, your monitoring staff seem like a really mature program. They're talking a lot with patients, and they're using this stat alarm pretty infrequently as needed. And then because of that, the response to the stat alarm is really quick by your bedside staff. And so you're kind of outperforming the national benchmarks on that. So what are you doing to get those good outcomes?
Yeah, and I thank you for that recognition too. And we do have, according to our ORNA data, we do have a 17.6 second stat alarm response time, which I even thought, oh, that sounds a little high, but it really isn't, because I got a little nervous, but it really is a good response time. And I think that what we've done, like I said, it starts from the beginning, and Tiffany and I, have both said on both of our campuses that it's about the person you have, in place, and how you set the expectations from the interview process. Because this to me and to our organization is a safety. We're looking for out for the safety of our patients, and our primary number one goal is to keep our patients safe, free from falling, free from injury, keep a safe environment for our workforce, for our nursing staff. So setting those expectations for that from the very beginning, from the door through orientation, is crucial. And we've set very high standards of performance. The oversight is very important. So, in the role of the manager and the leaders, and it's not just during the day shift when the manager, or whatever shift the manager is on, but it's also that oversight includes the nursing supervisors during the off shifts and the weekends, to be able to get to the AvaSure monitor techs to make sure they're okay, to make sure that they are doing, that they're in the room, because it's very taxing. They're in there, they're watching, and make sure that they are, that they're doing their job and meeting those expectations 24/7. It's important for all of us that accountability is extremely important. So making sure that they feel supported is really, and they feel like they're a valued part of the team. So what we've done here is that we have included our AvaSure monitor techs and safety sitters and rounders in, if there's been an event, an untoward event, if we do have a fall while the patient is on a device, if we do have an event that happened at the bedside, we include them in our RCA or our ACA when we look and drill down into, what happened. So that inclusivity is really important. So they feel very much a part of the team, not just somebody who's sitting behind the monitor video, but they're actually a part of the team. Their collaboration with the units and the unit leadership and the nurses, we have to continually foster that good communication. Again, that collaboration is part of the team. That really helps with retention, feeling great about what you're doing, feeling like you're really being part of the work of the day and keeping that patient safe has helped us to retain. But one of the things we've seen is that we've lost staff for, like, we're 8-hour shifts here. So with our unlicensed providers, our nurses are 12-hour shifts, our PCTs and sitters are 8 hours. So that mid shift is where we're seeing the most amount of turnover in that mid shift. Difficult to recruit for. So that retention is hard on that mid shift. So it's something we're looking at right now. We may change that model because it's been so, so hard to fill it. And like I said earlier, we have a program that is a great catch program too, and we recognize our staff, and I guess we'll talk about that in a little while. However, as I said, they're really being part of the team, and being recognized for that work is part of what we do for retention. We also have I didn't talk about this in recruiting, but I just want to mention this here because it helps for our retention too. Our learners, we created a Earn While You Learn program. So they can, for our students, like I said earlier, our nursing students or allied health students, we onboard them as per diems. They work in this capacity, or PCTs at the bedside, and they really like this, and they can earn money while they're in school. And we're very flexible to their schedules, flexible to their educational needs and schedules. They can work when they want to work, give us the hours that they want to work. And that has done a great job, both on the PCT side and the sitter side and the AvaSure monitor tech side, to retain them, because they're here and it gets them, it's a foot in the door. So for us, it's a great feeder. It feeds the pipeline. It's the foot in the door. They get familiar with medical technology and the workings of a hospital and the hospital setting, and what is a Foley catheter and what is an IV and what is what's patient safety, what's high reliability. They become very intimate with that knowledge, and they feel that translates to their work as a learner. Also, they learn how to speak to patients, and that's one of the biggest things for learners, is they're learning how to communicate, and our nurses or allied health professionals need to communicate. This is one avenue that they broaden that skill set for communication and mitigation of a high risk or potential high risk situation.
And I think what you're talking about actually takes some courage as a leader. You talked about needing to have courage as a characteristic of your monitoring staff, but really having the courage to have high standards, and if someone doesn't fit, let them go, because that just discourages your high performers if a low performance is tolerated. And that can seem counterintuitive at a time when, oh my gosh, we're competing with Costco or Walmart, or so maybe I have to tolerate low performance, but actually that's counterproductive and sabotages your ability to retain that high quality staff.
It's really important to try to hone in on that, because it is easy. That's why when I said about that oversight of the manager or the nursing leadership to really keep checking in. As a case in point, I even walked in one time because I check frequently and looked, and there was someone sitting there. One of our our AvaSure monitor technicians was sitting watching a movie on her phone with the headset off, with the earbuds in, watching the movie, and and that's absolutely a no-go. That was instantaneous. I can't rest, I can't sleep at night if I know someone's there, and it's not upholding. So that's the hard part about this is, you have to have high standards, and we have to make sure that we're monitoring folks who may be taking advantage, and I hate to think ill of anybody. However, it happens, but we have to be very, very diligent in making sure that those folks who are not that dedicated and meeting the standards are transitioned out of the position.
And you know that one-to-one sitters sometimes do that as well. So it's just about that accountability that you have to establish. And you mentioned that your stat alarm response time was 17.6 seconds. So there's an article, and I was a co-author in the Clinics of Geriatric Medicine about fall prevention and using virtual safety sitters for that. And we were able to demonstrate that 19 seconds is kind of the cutoff point. So when the stat alarm response time is over 19 seconds, there is a statistically significant higher risk of falls on camera. So that's like a good benchmark to have. And of course it went up during COVID. So on the isolation patients, it's an extra 18 seconds to get into the room. But I can talk about stat alarm response time all day, so I'll shift back to the topic of the day. So thank you for all of that, Lori. And Tiffany, what are you doing at the Dallas VA about retention and career pathing, all of that?
Sure. So, very similar to Lori, I think, biggest value we can bring to staff is really their professional growth when they enter our program. So typically we're hiring nursing assistants that have been only in direct patient care, and that's been their mainstay. And so it's just something different we can offer them. It really enhances their communication skills. And I think a big part too is their computer skills. And when I say that, I'm not talking about just charting in the chart, entering vitals. Our team has to use Word and Excel. So those are things they typically would not do in traditional nursing assistant roles. And they get, at first, it is a little scary for them when they're learning how to save the files, which folder to drop it in. You have to email it to the house supervisors. So it's a lot of technology they're also having to absorb. But when you see, some of the monitor techs I talked to in a couple months, they're like, yeah, this was really hard at first, and now it's easy, and now I know how to do it. And so what I find that has translated into is actually positive turnover for my team, in a sense where a lot of my folks are getting promotions, a lot of my strong performers, which is great. I'm always happier for them. That is always my goal, to hire folks and then get them to the place where they'd like to be. Because I know that this is obviously more entry level, or, for the staff that decide to stay, they make it their career, which is also great. But I do know that a lot of my strong performers end up getting promoted to clerk type positions where, they're working with the patient administrative service. They're making appointments, working on data entry, insurance claims. So that's just really great for them. And again, that positive turnover tells me that our program is headed in the right direction, because people are growing. And when other people see that, they're like, well, that's really great. I want to join that team too, because then, in a couple of years, that's something that I can grow to. So, even with turnover sometimes, and it's hard, it's also great, because then, even when they go on the units, or some people that become nurses on the units, then they're speaking about the program and they're promoting it amongst their colleagues and amongst their own patients. So I think it's a really great, full circle that we've been able to see. If you got nursing students end up working on the units, they're already thinking AvaSure, and then they know the team, so that's great. So they are able to, still communicate with them. So, yeah.
But I love the positive turnover. And at our symposium in October, we had a similar presentation about managing hub and spoke. And so Trinity Health has a hub in Chicago where they're monitoring like 40 hospitals, a couple hundred patients, so it's a very large hub, and they have positive turnover as well. And he was talking about that at our symposium. And I think for those of you that are on the line and maybe just about to start a program or are struggling with your recruiting, putting that in front of someone on the recruiting side. So we have seen this type of positive turnover. You know, here's a career path for you, whether it's a clerk type of position, or phlebotomy, or MA, or nursing. You know, if you are in Lori's hospital, you can get sounds like some amazing tuition reimbursement. So that's a great recruiting tool as well as a retention story. So Lori, you mentioned a great catch, and that's part of the recognition. And recognition is a huge topic. So we talked about recruiting, orienting, retention, and now let's talk a little bit about recognition. And please tell us about that great catch program.
Sure. So as a high reliability organization, what's important is to recognize when we mitigate any safety incident, or we have, you know, great catches to that stops the line, and something doesn't move forward that could be, you know, detrimental to harm the patient or our workers. So we have a good catch program, and it's great when we've had our AvaSure monitor technicians be recognized in the Great Catch program for there's two things. One I'm going to talk about. One was just great. The first one I'll tell you about was when you're talking to the AvaSure monitor techs, they'll tell you they know the patients, and they really do. They're watching them day after day. And I think we all can say, yes, they get to know them very well, and they see, you know, their pattern of, you know, whether they're getting better and when they're not getting better. So we had one instance where one of our technicians was watching a patient, and day after day, and noticed that their respiratory rate was changing. The patient was getting more agitated over time, was certainly far different than they were the day prior to that. And noticed that there was just something off, something wrong, and breathing really heavy, and like I said, agitated, and spoke up and spoke and called into the nurse, and they called a rapid response, and absolutely the patient was deteriorating. So they caught the deterioration, and it was such a great catch because they were able to intervene, medically intervene for the patient, and the patient wound up staying right on the unit, and it was resolved in the unit without it getting, you know, you've tried your RRTs, you want to keep the patients on the unit, and that was only because of the AvaSure monitor tech. So I get goosebumps. That was really good. So we were able to take that story, and we were able to publicly recognize among all of our leaders this wonderful great catch. So we have a whole certificate, and we have, you know, all that stuff. So it's this one, it was great.
To avoid an ICU admission is amazing, and everybody's nurses are, you know, have more novice nurses, and they're just stretched. The acuity is high. Lori, you were telling me your acuity is high, and your census is high today. So if you have somebody who's, you know, knows the patients really well, who can sound the alarm, that's amazing.
Yeah. I have one more though I want to share, because it was really interesting, and it wasn't necessarily, you know, it was a good catch, and it was for a great reason. We had the AvaSure tech saw a visitor in the patient's room. And knowing the visitors that go in and out of the room and who visits at the bedside, you know, they're watching that. They watch the interactions of the visitors, the family members, and the patient. They witnessed what looked like the family member intervening with the patient in a very negative way, and they got a bad vibe, quote unquote, just got a bad vibe. So they turned the speaker on, and when they turned the speaker on, they heard the family member was threatening the patient, was threatening to give the patient medication, calling the patient bad names, obscenities, etc. So she sounded the alarm, which got people to the bedside. She was able to explain what she witnessed and interacted, and it was a horrible spouse abuse situation. Where the family, the patient was not able to verbalize that she did not want the spouse there, and we were able to remove the spouse.
Wow, I have chills. That's just like, you can't, that's priceless. You can't even, yeah, thank you for sharing that. Tiffany, what are you doing for recognition at your program?
So recently we recognized a number of the team members. It was national. We did have an ice storm here in Dallas, and we, of course, really just crippled the area where staff couldn't get in. And so really the plan is, before the ice storm comes in, who can stay? So that's going to be like the way that you keep your operations going. So I had a group of staff. I really didn't have to ask. I've got a stellar group of staff, and they said, Tiffany, hey, we're coming at this time. Is it okay? And of course, I'm like, yes. And so I had a group of my all-stars camp out, and we stayed together 24/7 for 3 consecutive days, with cots, so like sleeping in the room. We had a great setup. And I think it really speaks to the quality of staff that you hire. So when you hire right, you have staff that are committed to the mission, committed to keeping the program sustainable. And really, our nurse exec was really glad because we had cameras going out left and right because we couldn't sustain the sitter and the one-to-one necessarily. So we were in, emergency crisis staffing, and AvaSure definitely did help to get us through that rough patch of staffing. And recently we could we pull up the photo, Lisbeth?
Yeah.
Do we have a picture? Okay, great. Because I always want to, brag about my team here when I can. And we have a photo coming up. AvaSure did give us the Ava Prize Award for 2022. And if you look to my left, there are a group of staff, and this was the same staff that came in on their day off to meet AvaSure and get recognized with the award, are the same people that volunteered to come and stay for the ice storm. So again, it speaks for itself. When you hire a quality group of nurses, you will get quality outcomes. And AvaSure is also gracious in printing certificates for each team member. So we were able to really make sure that everyone that even couldn't make it to the ceremony felt recognized and a part of the recognition. So I just, couldn't be prouder to lead such a great team.
Yeah, and in this picture, you are and Juliet and Ninye are holding the Ava Prize together.
Yeah.
And tell us a little bit about Juliet and Ninye, because she's an LVN, a licensed vocational nurse.
Yes.
And I just am loving kind of seeing that role starting to get more elevated now in our time of need. And so you did a really special recognition for her as well.
Yeah, so Juliet was the recipient of the 2022 Nurse Excellence Award that they give at the level of Washington, D.C. So, I put her in for the award because she's done such great work with our group. And really, it was because of our utilization that went up as we were monitoring it from year to year. So during Nurses Week, she was able to meet the Secretary of the Department of Veterans Affairs, meet the nurse executive that really is overall the entire VHA system of care, and receive an award there. So that was really special for her and for our entire team. We had, of course, a huge celebration for her from the facility. And I think it's just really great that we can have all levels of nursing really impact this type of program. Whether you're a nursing assistant, LVN, or an RN, it really does help because our team is so diverse. And so when we speak to other nurses, other disciplines, I think that really helps our program and makes it stronger.
Yeah, and it was just some of us from AvaSure in that picture there, we were able to come down and deliver that prize in person. And and this is actually when I had the idea to ask you to be on the webinar today, because that safety attendant in the plaid shirt and the one in the purple pants and the one in the jeans, they came in on their day off, drove in just to be part of this, and that was just so heartwarming to me. And so thank you for both of you, what you're doing for recognizing and this and creating a career path as well, which I think is just amazing. Did you? I think we always like to close with good catches. I know some of you already shared. I think you both already shared great catches. Did I miss some? Because did you have any other good catch that you wanted to share today? We did get a couple other questions typed in, so we can talk about those too.
Yeah, we can go to the questions. I think that.
Okay. Oh, this is a good one. And maybe, Lori, since your program is newer, or you could both talk about this, but how did you justify these FTEs to your senior leadership?
Yeah, great question, because finance and the landscape of healthcare across the United States right now, and from a financial perspective, we take such a big hit right now, especially emerging through COVID. And it is one of those things that really needs to, have a focused spotlight on as we're trying to conserve. We're all financial stewards of our organizations. So that being said, the cost of a fall is tremendous. The cost of a fall with injury, tremendous, detrimental to anybody. But the way that we did it, here we really looked at the offset of utilizing our safety sitters in this arena. So it wasn't really an ad. We added some safety sitters into our pool to begin with. So we were able to utilize that to be cost neutral. I've been very adamant, though, being here, and I'll just speak for myself, that at the end of the day, this is about safety. And our finance folks are always, how much are we going to save, by this, and what are we going to save? And I'm like, I'm not going to go there. I'm not going to say we're going to save X number of FTEs at the bedside for safety sitters, because it depends, as we probably all can say, depends on our population and moment in time. I think our behavioral health and mental health patients who require suicide one-to-ones has grown dramatically. Yes. So it has been a shift, and shift there, and there's been a shift at the bedside for those who don't meet the requirements for an AvaSure monitor at the bedside either. For true safety, they are impulsive. Patients are much more confused. This post-COVID or syndromes have taken people into a whole different arena. So I basically have hold steady with saying, let's hold off on saying we're going to be able to reduce X number of FTEs by doing this, and let's just watch for the pieces of mitigating risk and keeping our patients safe.
I have also heard, those are great points, and I've also heard that when making the business case, the cost, so it's 1 to 12, you're both doing 1 to 12. I think it can go up to 16. It really depends on the acuity of the patients.
Right.
But the cost with the technology and 1/12 of an FTE is probably less than $3 an hour versus the $20 an hour. New Jersey, I don't know, it's probably more. For the one-to-one sitter. So that's a pretty easy way to talk about the business case. And we also offer tools for that, and anybody who might be interested. Do you have anything to add on justifying the FTEs, Tiffany?
Yeah, so I can actually speak to some of because our program has been longstanding for a couple of years now. I recently did submit an abstract and had to crunch out some numbers. And what we did was we looked at the cost of 1 FTE multiplied by how many hours we've been monitoring. Because really, truly, they would have turned maybe not all into like a 1-to-1 per se, but a lot of them would have. So when we did the math over the last 3 years, it translated it into savings of about approximately $4 million. So I think, the numbers speak for itself. Of course, as Lori said, safety is always first. But again, with that said, of course, my leadership is always really great to see that kind of data come out, and it takes a while, to generate and to see that value played up. But at this point in time, with an established program, you can really see that, yes, it definitely, there is a business case for the program.
And you reminded me, so Monday, I think you got the email from ANCC Magnet that you've been chosen to do a podium presentation, an hour-long podium presentation at the Magnet conference in October. So mark your calendars now. And come in here, Tiffany, and share about their program at Magnet, right?
Yes, that'll be in October. Yep.
Yes, congratulations on that.
Thank
That's
you.
great. Yeah.
Exciting.
So that's and if you submit an abstract, then it forces you to do some of that.
Yeah. You gotta look back. Yes.
Number crunching and look back. Somebody asked this question: are any tips for recruiting at a hub? And so I know that neither of you kind of have that really large hub and spoke implementation where there's one central hub that's away from the hospitals. But we did have at this symposium in October a couple of presenters talk about hub and spoke monitoring, and one was Baptist Health, and one of their their keys to recruiting for monitoring at a hub that it was separate from the hospitals was better parking and also pajama day and stuff like that. So anyways, I hope our team can put something in the chat for the person that asked that question so that they can view that webinar. Got lots of questions about the HealthStream modules. Please reach out to your clinical program specialist at AvaSure to make sure that you're hooked up on those. You don't have to have HealthStream, and it can go with any learning management system. So we're happy to help, and that's included. That's part of the package. We feel like we don't want to just, drop off some technology and then say good luck with it. The education and those learning modules must come with it, as well as a lot of other support and data. Let's see. So this is, do you use RNs? If so, what staff level? No, right? No, you don't. Okay, yeah. No, this is not an RN position. Although I know that sometimes if for one-to-one sitters, if the demand is really high and you don't have an option for telesitting, I know I've been used as a sitter, as an RN, just because, or labor and delivery is quiet tonight. It's not a full moon. So let's take some of those highly trained, very expensive labor and delivery nurses and have them sit one-to-one, which is just really, really, really inefficient. So do you have your monitoring staff undergo any specific clinical training, medical terminology, anything like that, or is that kind of what they learn on orientation? And
they learn it during orientation, but no specific medical terminology is needed or requirement and/or is utilized. No, we don't. But they learn that it is part of the overall comprehensive, onboarding, so that they understand some, the basic clinical acumen of what's happening with a patient.
Okay, yeah. Well, we are pretty much at the end of our time. Thank you so much. We'll have a slide at the end of this presentation that will promote our next in the virtual nursing webinar series that's coming up. And we are going to be doing regional symposiums this year. So more to come on that. We'll have an in-person symposium coming to a place near you, wherever you are. So thank you both. It was a great conversation, and thank you for all that you're doing to promote patient safety.
Thank you.
Thank you.